we first think of doctors, we think of people that will do whatever they can to help us live. We think of doctors when we're sick or when we're near death because we know that they will help us regain our health. And however, there is something called euthanasia. When people realized that this existed, they thought that it was sort of like their doctors killing their patients because they give them the means to die. Today I am going to persuade the audience that euthanasia is not murder and that it should be reflected as something that helps make other people's lives less painful. First, I will be telling you about how euthanasia was created and why. Second, I will tell you about how euthanasia is performed. And third, I will be telling you about when they are allowed to perform euthanasia. Euthanasia is when a doctor is allowed by law to end a person's life by a painless means, as long as their patient and their family agree with the decision. Euthanasia first was used in the 17th century by Francis Bacon. At this time, it was referred as an easy, painless, happy death. It was a physician's responsibility to alleviate the physical suffering of the body. In some places, euthanasia is legal and in others it's illegal. In the Netherlands, it was first legalized, and then the first state in the US to legalize it was Oregon. On June 9, 2016, the End of Life Option Act was taken into effect in California. Since 2006, euthanasia has been the most researched topic in bioethics. There have been different opinions about euthanasia. Many people say that it's illegal or immoral, and some say that it's unethical. Others think that the opposite and that it should be approved during certain circumstances. Now that I have told you about how euthanasia was created and why, I will tell you about how euthanasia is performed. In the Netherlands, euthanasia is performed by the attending physician administering a fatal dose of a suitable drug. The patient has to request it. There are also some advance directives that people can sign. These are used for when people want euthanasia to be performed if they are like in a coma or their pain is unbearable or they can't speak for themselves. It can only be used when you can't see like any form of improvement that will happen in near or far future. Another form of euthanasia is when a person has decided to sign a DNR. DNR is a do not resuscitate request. This signifies that the person doesn't want to be resuscitated in any medical emergency. This means that they're not allowed to do anything like CPR or give her any type of surgery or help that they need to revive them. There are different drugs that can be administered during this process. Sometimes they use capsules, or sometimes they use liquid, or sometimes they can inject it into a person. Now that I have told you about how euthanasia is performed, I'm going to tell you about when it is right to perform euthanasia. In California, a person must be a California resident and be at least 18 years old and temporarily ill with no more than 6 months to live. All the licensed medical doctors in California are allowed to prescribe lethal medications. The patient must be deemed terminally ill and mentally competent by 2 physicians to receive a prescription. Doctors are not required to neither prescribe the medication nor patients to doctors who will write such prescription. A patient must tell her doctor on 2 separate occasions. They must tell them the first time and then 15 days after. They have to discuss the details and explain to them what will happen. In the Netherlands, it must pass through committees that let them know if they are allowed to do it or not. It takes 6 to 12 weeks to know if they're eligible. Euthanasia is not something that should be seen as immoral or unethical because they are keeping people from suffering more than they want or should. It is not something that is decided just as a quick decision or carelessly. There are many steps to come down to this decision, and that's when you know that it's the right thing to do. Today I have informed you about first how euthanasia is created, second how euthanasia is performed, and third when euthanasia is able to be performed.